before Hypercare was even an idea or a project. What were some of the challenges that you saw both in your clinical life and as an administrator?
Yeah, so I think the first part really was just trying to actually hunt down people and be able to actually hunt down the right person. It was too many mistakes, too many barriers, too many missed calls, people getting woken up in the middle of the night.
Prior to Hypercare, what were you guys doing in terms of communication? What were some of the challenges that you were encountering?
Well, we were on a telephone and pager system. We still had our pager towers, we still had internal physician locating.
The locating was then given to a third party. Oftentimes we would get paged to the wrong number, the wrong physician would get paged.
It gets very frustrating and it gets very dangerous.
Before Hypercare, what were some of the problems and challenges you saw on the day-to-day operational side?
We joke here at HSN how we were cups and strings. It was old, antiquated software, the system, the way we did things, and Hypercare brought us up to speed with everyone else.
And before Hypercare, we had a third party that handled what we call doctors locating. Trying to find another physician was like a 3-person or 4-person conversation.
When did you start realizing that communication was an issue? Like, when did you start realizing that it was a problem? And what was the impetus to look for something new?
I think as frontline staff, it was apparent as soon as we made the switch a few years ago to utilize an external calling party to locate our physicians on call. I know that the frontline staff had a lot of struggles with that right off the bat, and I think it only got worse.
We definitely wanted something that was implemented in other hospitals that could meet the privacy and security requirements that we had at the time. Hypercare immediately checked all the boxes from a functionality perspective.
Certainly using a platform that's HIPAA compliant with secure abilities to send photos of x-rays and clinical photos and patient information. That's a necessity.
When I heard about Hypercare and I was given access to it just to play around with, I did everything possible to basically break it, and I couldn't do it, but I was able to get a good sense on how the messaging platform was going to work.
And how has the feedback been from Switchboard?
They love it. They want to run with it. They love it. It makes their jobs a lot easier.
We don't have to go through like a big loop to get one of the doctors. It's just one-on-one conversation, and I guess that less people involved, so less margin for mistakes to happen.
Honestly, you guys were amazing. I can honestly say that. Personable, very approachable, and you guys were available.
Working with Hypercare was great. Actually, you set a bar pretty high for vendors. We rolled out like 38 different departments, and someone from Hypercare was present for every onboarding session.
We were able to confidently tell our staff frontline, like, it's going to be user-friendly. I promise you, you're going to be able to do this and make this change even if you are adjusting to the transition on a shift in real time.
I personally love Hypercare. It's made our life so much easier. It's in my pocket. I page doctors walking up and down the hallway, have instant answers. Like, our day-to-day at the hospital is so much better.
The Hypercare team and the team at Health Sciences North offered a lot of support for us to be able to send the message to the team as to why we're doing this, why we're going to Hypercare, how it's going to improve workflows, and how it's just going to make our lives better in the emergency department.
The team from Hypercare was very helpful, and the demos were very workflow appropriate, so the Hypercare team was very representative of what a physician would be looking for.
You can win any day telling an emerg doc they will be faster and more efficient at what they do. So I was sold off those few words initially, and then it's just proven to do exactly that, so it's been really great.
I think the energy from the Hypercare team helped build the energy on the HSN side, which alleviated, I think, some of those pressures and some of the stresses of the short timelines.
Communication is huge, like the back and forth. Nothing gets done if there is zero communication with the vendor, which I have seen on other projects. I'd have a Zoom link and we'd be communicating, and my question would be answered almost immediately.
We could really rely on the Hypercare team to fill in those knowledge gaps that we obviously didn't have at the beginning of the project.
The company was able to come on site with us, which we'd not often experienced.
And the fact that Albert was around every once in a while, as the CEO of the company, and it's like, oh, that's pretty cool. You know, and he was able to actually have some conversations with some of our more reticent doctors and smooth things over, so that was huge.